So here we are at your office, at the WVU Medicine Thomas, the Children's Pediatric Wing. And how many beds do you have here on the floor?
Like 8 beds here, all private beds, no shared beds, no shared rooms. To keep it private, convenient, and
you don't want to share germs between kids.
And safe. It's a safe environment.
Yes, absolutely. And of course, it's locked.
It's locked. Yeah, it's secured, locked. Patient's room.
All right, good. And we'll just walk on now. Hello, and welcome to another episode of Spotlight on Health. Today, we are filming here at Thomas Memorial Hospital, part of the WVU Medicine System, and we have a special guest, the pediatric hospitalist and also the director of pediatrics for WVU Thomas Hospital, Dr. Musitat. Welcome, and thank you so much for joining us here and allowing us to film the show here in your office, per se.
Oh, thank you so much. Thank you for having me. It's a pleasure to be here with you guys.
So today we're going to talk about a disease that has caused a lot of calls recently. There has been an outbreak in one of our local schools and has caused a lot of concern in our community. So for this particular episode, we elected to bring in a pediatric hospitalist who is more of an expert, particularly in the field of not just pediatric disease, but also infectious disease that is not necessarily super common, but common enough to be on your radar as a physician. So tell us a little bit about pertussis, also known as whooping cough.
So I will start with a general definition of the whooping cough of pertussis. It does have several names. I will call it the whooping cough. I can call it like the 100-day cough because it lasts and lingers for many, many days and weeks. So it's one, for me, the way I look at pertussis, it's like very contagious, horrible, but preventable cough. So for me, that's the way I look at it. It's just like very contagious. It spreads pretty quickly when you have an outbreak, and it can cause like significant, cough. It can be very tough, especially on infants. But the bright side about it, it's preventable.
Preventable. That is, I think, the key word on this.
That's the key word.
So here at WVU Medicine Thomas Hospital, tell me a little bit about what you do here within the hospital.
So, of course, we do take care of patients when they come in with acute illness. So that's why, especially wintertime, it's just like the season for all respiratory illnesses, asthma, RSV. And that's why, part of the respiratory distress that we see, we always have to keep now pertussis, on our radar.
Oh, yes.
So keep that in mind. So we typically take care of, kids when they're sick enough, they are in distress, they're having, high fevers, they're dehydrated. They need to come and get admitted, and we take care of these patients.
Mm-hmm. So your focus is mainly on the inpatient care. Mm-hmm. So these are your sicker kids, shall we say?
Right. Yeah.
Yes. Now, talking about pertussis, you provided some good slides. And on the first slide, you talk a little bit about how contagious it is. Why is pertussis so contagious?
I really think because pertussis, it spreads through the droplets. So if you have a patient who is sneezing, coughing, and then with these secretions, this is how the illness spread.
Mm-hmm. So it's spread through the air when somebody coughs out of the air.
Mm-hmm. The other thing is just these droplets and the Portadella, the bacterium that can cause pertussis, it survives on the surfaces for several days.
Several days.
Yeah.
So even if somebody touched a doorknob, that doorknob could be infectious for days?
Exactly. So it can be, and if we had any kind of secretions that touch the surface, the bacterium will last and survive for a couple of days on that surface. If you have another person who touches that surface and then touch the eye, touch the face, so they can get infected. Mm-hmm. The other reason why this is very contagious, because most of the time it's very contagious in the early phase of the disease, which most of the time we do not diagnose sometimes the illness very early. So
somebody could have the disease and not even realize it for a while, and then they're spreading it to other people.
Correct.
I see. That makes it more on the highly contagious side of the diseases.
So, and that's why we're just gonna talk about like the stages of the disease. So pertussis is a little different than other bacterial infections that can cause like respiratory distress, because it does have three main stages. So the very first stage, which is the most contagious stage, I would call it, is called the catarrhal stage. But the patients will have a very mild symptoms, so which will not bring a significant concern, but they're really contagious.
Mm-hmm. So what kind of symptoms are they having in this catarrhal stage or the early stage?
So basically, it's going to be very mild, watery, runny nose. It can be watery eyes, very mild cough. It's not that whooping cough yet. So they will have like URI symptoms. So, and that's why
meaning just a common
cold,
upper respiratory infection.
Correct.
So children and parents or even cliniicians may not even realize that they have pertussis at that point.
That's very typical. And sometimes that's why we can overlook the pertussis diagnosis in the early stage, in the catarrhal stage.
Mm-hmm.
So
tell me about the next stage.
The second stage is the paroxysmal stage. And this is when we have the whooping cough starts. Whooping cough, which means like fits of cough, like 15, 13 times in a row. So the patient, and then that will end with the whoop, which means this is when the air enters the swollen airways. So, and cause that sound, the whoop sound.
Oh yes,
which is
pretty classic.
Very classic. And again, this classic presentation, it's mainly for older children and adolescents and adults. So we're just going to talk in a little bit about the little infant under age of 1 or 6 months. They will act a little different than that classic whooping presentation. So majority of these kids, when they have the whooping cough and these coughing fits, they get exhausted. You can imagine having 15, times cough in a row. So they get exhausted. They will have the chest pain, the muscle pain. So they will be tender. And it's very common to have what we call post-tussive vomiting, which means cough, 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 and then they will start throwing up after. So, and that's kind of the classic presentation. That this paroxysmal or whooping cough, period, it can last to between 2 weeks up to 4 to 6 weeks.
Up to 4 to 6 weeks. That's a lot of coughing.
It's a lot of coughing.
Yes. Now, how long into that stage are they typically infective if they've received treatment?
So again, the treatment works the best if we can provide the treatment in the catarrhal stage, in the early stage.
So early stage.
So usually we know the treatment can shorten the duration and severity of the illness if we start early. And we mentioned earlier, most of the time we really do not diagnose pertussis that early. So treatment is not going to be very helpful during the paroxysmal stage. It will help to prevent the illness. It's not going to change the duration if they get to the point that they are having the whooping cough. So after that, they will start to feel better. But gradually. So this is.
So what's the late stage of it?
So this is kind
the convalescent, the healing.
The healing, the recovery stage. They will have the cough lingering for sure for several weeks, several months. So up to 100 days. And
wow, up to 100 days.
It's not going to be as frequent. So this is when we start seeing less frequency of the coughing fits.
Yeah, I have seen a few cases of whooping cough being an ER physician for many years. Saw more, I think, overseas than here, fortunately, because West Virginia has a very strong immunization of our children. So we don't see a lot of cases here. But when we do, they're not good. It could be very scary, especially for the little ones.
Exactly.
The infants that have not yet been fully immunized, or they're too young to have received even any immunization. So let's talk a little bit about the risks to infants and why we really want to watch out for pertussis in these little ones.
So I mentioned earlier, pertussis in infants will present in a very different way. And I think it's the scariest way it can present. So I've seen kids or infants coming through the ER with apnea, which means when babies quit breathing. So we just actually had a recent patient who just was 2 months old who presented with just apneic spells. The baby was not breathing and it ended up being a pertussis case. So it's very scary when you see these infants because they quit breathing, they turn blue. It's like, I think for the parents, it's probably one of the most traumatic, event to witness.
Well, I don't think any parent wants to see their baby stop breathing and turn blue.
And they do. And then these are the kids or the patients who will definitely end up being in the hospital. They will require ventilation and help, respiratory support as well.
Mm-hmm. About what percentage of infants or young children who get whooping cough have to be hospitalized?
So I would say almost 1/3, 30 to 40% of infants under age of 6 months, they will end up being admitted to the
That's
hospital.
a very high rate.
It is very high rate. And then the mortality rate, which means the risk for them to have the worst outcome, is really high in infants as well.
Wow, it's very scary, especially for parents.
It's and unfortunately, infants, this is the portion of population that we cannot give them the vaccine, and that takes us why it's so important for pregnant women to get the vaccine to transfer that immunity to the babies after birth.
So let's talk about immunization of pregnant women. So can pregnant women receive the pertussis vaccine?
Yes, it's the standard recommendations for all pregnant women to get the pertussis vaccine, or what we call the Tdap, in the third trimester of pregnancy, 27 weeks to 35 weeks. To give them enough time to develop the antibodies that will pass through the placenta to the babies. And that will help to protect the babies until they can get their first set of vaccines.
So if the mom is immunized, she passes on that protection to the baby.
Yes. Correct. That's pretty much it.
Excellent. That's really important because we can't immunize these small babies. So this is really the only protection they get. Yeah.
The earliest age for the babies to get the first, pertussis vaccine at age of 2 months. So we give vaccines 2, 4, 6 months of age, and then around 15 to 18 months, and then their booster will be 4 to 5 years, school entry age.
Yeah. So that 2, 4, 6 month age. When a baby starts getting the vaccine, how soon can you expect it to begin to have enough antibodies or immunity so that it doesn't get sick?
Not before they get at least 3 doses of the vaccine.
3 doses.
Even if we have a 4-month-old, I would not say received 1 or 2 doses of the vaccine. They're not immunized yet.
So essentially, up through the first 6 months, they could be very susceptible, particularly if the mother's not been immunized.
Yes. And then these are the highest risk, patients to get the pertussis.
Yeah, it is very scary. Having a blue baby come in is never a good thing.
Yeah. So as a providers, we always have to keep in mind, just if we have apneic patients or baby, pertussis should be on the differential, on the list.
Absolutely. And you mentioned that the pertussis vaccine is in the Tdap. So what does the Tdap mean?
So it does have a combination of the tetanus and then the acellular pertussis. So the babies, who will benefit from the vaccine? We mentioned all the babies, they need to get the DTaP, the diphtheria, tetanus, and acellular pertussis vaccine. And then it's now recommended. And just remember, the immunity that the children get from the vaccine will fade over time. So it's not the same level of immunity over the years. So it fades over time. And that's why the recommendations for all adolescents to get a booster of the pertussis, vaccine. So
the immunity does fade. So you get both tetanus and whooping cough in the same shot. But those do wane. So typically throughout your life, about how often do you have to get a booster?
So we get the booster for adolescent, patients, and then pregnant women. So, and then just otherwise, we need to vaccinate, the children as well. And that's pretty much the protocol.
So adults, when they get older, can they still get pertussis, or that is whooping cough?
So usually we do not give the pertussis vaccine again, but just remember that elderly who are at higher risk to have severe illness as well, hopefully you will be protected by what we call the herd immunity. if we can immunize every single patient who is eligible and can get the vaccine, and we get them protected and we limit the spread of pertussis, that will provide immunity for the elderly or immunocompromised patients who cannot get the vaccine.
That's a really important point, that we are keeping our herd immune. So in the ER, we frequently give the tetanus shot from mainly people that have had injuries like lacerations, cuts to prevent tetanus. But that shot that we give in the ER is actually the Tdap, and it has the pertussis mixed into it because we have seen more and more cases in adults. So I found that if you keep up your tetanus shot, you're really keeping up your pertussis or your whooping cough shot at the same time.
That's very true. And again, just it will help the tetanus, booster and the pertussis booster. If they keep it on schedule, they will get it every 10 years. So hopefully that will protect them.
Yeah. So the key to not getting pertussis in our community is definitely the vaccinations, for sure. So let's talk a little bit about how resistant this bacteria is, that you can have it get on doorknobs, on chairs, couches, and it will last for days.
Yeah.
So how do we prevent pertussis from spreading, even though it's aerosolized, when people have touched things?
Exactly. So it just go back to the normal, routine and measures that we always try to educate patients, staff to do hand washing. I would say good hand washing is the key.
Mm-hmm.
So we cannot emphasize more on hand washing to really prevent the spread of any illness, especially if it's droplet.
What about the hand sanitizers? Do they work on pertussis?
They do.
They do? Good. Yeah, because we always have those out, and we see a lot of people.
So
and the health department, we actually give them out at Christmas.
I always say water and soap is the best. If you don't have it, hand sanitizer will be just good.
Mm-hmm. What about for other surfaces? Can you just use a Lysol spray? Will that work for pertussis?
We do have to follow the hospital policies and measures to clean all the surfaces, for parents as well, to make sure to kind of clean all the surfaces and to prevent the spread. Definitely at the hospital, of course, wearing mask is very important, especially if you have if you're worried about any droplets, spread of any illness.
Good. What about masking if you are suspicious that you might have pertussis or you've been exposed? Should you mask immediately?
So definitely yes. Mask will prevent. Definitely. I would highly advise all the medical staff and providers to mask if you have a patient you're suspecting even URI symptoms until because you're never gonna know. They get tested and you will hear the news after. Okay, mm-hmm. Your patient tested positive for pertussis. It will be too late. So whenever you have a patient who comes in with respiratory symptoms, definitely wear a mask. Take the precautions before.
Yes. It's really important to try to prevent the spread because, as I love to say, the easiest disease to treat is the one you never get.
Exactly.
Yes. Let's talk a little bit about those, say you have an infant at home or a niece or nephew, grandchild, and someone in the family has had pertussis. And this little baby has not been immunized yet. Let's say it's only 2 or 3 months old. Do you typically give them an antibiotic to prevent them from getting an infection?
Yes. So we do have a certain guidelines we follow after exposure. And then I always reference to the Red Book, the AAP Red Book, as far as guidelines for kind of post-exposure prophylaxis treatment. But definitely the high risk people will need to get the post-exposure antibiotic treatment. Especially the household members. So all the household members should receive, we treat with macrolides or what we call azithromycin.
Mm-hmm.
And
you mean the Z-Pack?
The Z-Pack, exactly. So it's just safe, with a minimal side effects. So but it's really recommended for household to receive the treatment after exposure. As far as medical, providers and staff, unless they had a very close, unprotected exposure with secretions, So like these are the who we would recommend like prophylactic treatment for. But if like the immunization status up to date and we wore all the contact precautions, we followed all the contact precautions measures, so we should be okay.
So those of us in healthcare, you're pretty low risk, but also anyone who has been fully immunized, the risk of contracting this disease is pretty low.
Yes. So even immunized individuals, they can get pertussis. The good news, they will have a much milder symptoms. Mm-hmm. So their symptoms is not going to be as severe and hopefully the complications not going to be as severe as someone who was not immunized.
One of the big reasons that we're even talking about pertussis is the amount of disease that we're seeing in the community that wasn't there just a few years ago. Particularly, let's talk about West Virginia. So West Virginia has, in 2023 to 2024, had approximately double the number of cases occur. And why do you think that is happening? Is it?
So I really think I'm still proud of our state of like not having that significant increase in the cases of pertussis if we compare it to the national level. So I would say like even like the last reported cases, the total number of reported cases in December 2023, we were about 25 or like cases, and we're up to like 56 cases about the same time in 2024. Versus like national level, the number of total cases of pertussis were like 7,000 cases in December 2023, and we're up to like 35,000 in December 2024, which means like that number increased 6 times more.
6 times the number hit nationally.
Nationally. So I really think just like our increase or raise rate was not as bad as what we witnessed nationally. So, which makes me proud, to be honest, of our vaccination, policy and law. It's just like we for sure 98% of all kindergarten students in the state are immunized as of this year, versus national level 92% of kindergarten students received were fully immunized. By school,
Yeah, that's one of the highest rates in the nation. That probably explains a lot of the reason as to why we do not have the number of cases that the rest of the country is experiencing as we speak.
So vaccines work, and that's why I would hate for our kids to suffer from any disease that we can prevent.
Mm-hmm. I am the father of a 9-year-old little girl and a 6-year-old little boy. And I find fatherhood both relentlessly challenging and relentlessly rewarding. Both of our children came to us in amazing ways. My daughter is biological and my son is adopted. I love them both so much, from the morning when you wake up to putting them to bed at night and every moment in between. It really is so special, and boy, is it exhausting. One thing that I fear about being a parent is the future for my children, because I think a parent's job is to protect our children, but also prepare them for the world so they become good, kind human beings. But I'm also hopeful that the future holds a more inclusive and compassionate world for them. And I know that they're going to make the world a better place.
What to expect when you're expecting.
Like here?
A teenager.
Today, I'm going to show you how to teen-proof your home. First step, hide the car keys. Preferably somewhere they would never look. Challenges will come up. Be ready for them. Hi, honey.
I'm ready for the... Mom, you don't use mannequins in the mannequin challenge.
You don't have to know it all to be a perfect parent. Thousands of teens in foster care will love you just the same.
Tell me a little bit about your passion, particularly for pediatric medicine, given where you were born and raised and what you saw growing up as not just a child, but as a physician.
So I did my early training back home in Syria, where we, some patients, they did not have an access to healthcare. They did not get vaccines for so many different reasons. The lack of availability, they could not afford it for at some point. Again, regardless, it's expensive for some parents to be able to provide vaccines. So which resulted in just some of these kids will suffer from polio, will suffer from measles. They will have a severe complications after chickenpox. All these diseases that we almost forgot about. Since I came to the US, I've never seen a case of measles. I've never seen a case of diphtheria, which is I'm so grateful and thankful for. I did not have to treat. I almost forgot about it. And that's my goal. I don't want to see any kids suffering from these diseases. I would like to see empty beds in the hospital.
So you like empty beds?
I like empty beds. But if they need me, I'm here for them.
Yes.
I'm here to treat the kids when they need me. But I hope they don't get any of these kind of really scary diseases that can affect them and cause actually long-term effects as well. So if you think about polio, even when they survive, they will have a long-term disabilities, and we don't want that to our kids.
Not being able to run, potentially may not be able to walk.
That's our goal, to raise a healthy, happy generation, so who they can enjoy life and then play, be active, and stay healthy.
Yeah, I don't think any parent wants to see their child here in one of these beds.
It's very scary and stressful time to spend in the hospital.
Oh, no doubt, no doubt. Being an ER physician and also a physician that has traveled overseas a lot, I've had the opportunity to see a lot of the diseases that we typically don't see here, like polio and measles. And it is very scary. It's scary for the child, the parents, and as a provider, sometimes you're really saddened by the fact that this disease was probably preventable if they had had an immunization.
If they had the access to the immunization.
And in Syria, that didn't always occur for you.
Yep, it did not.
All right. Well, I want to thank you very much for allowing me to not just interview, but for you to educate us here on Spotlight on Health.
Thank you so much for having me.
It's been good.
Thank you.
And I'm your host, Dr. Stephen Eschenauer, and thank you again for joining us for Spotlight on Health.